This medication is administered slowly into a vein by a healthcare professional as directed by your doctor, typically every 4 weeks for a total of 6 injections. The dosage is determined by your medical condition, weight, lab tests, and response to treatment. It is important to stay hydrated while receiving this treatment. Be sure to drink plenty of fluids and consult your doctor or pharmacist with any questions. Since this medication releases radiation and may be present in the blood, urine, or stool for about 1 week after an injection, it is important to avoid contact with these bodily fluids for at least 1 week after your treatment. To minimize the risk of splashing, it is recommended to sit down on the toilet seat each time you use the bathroom during the 1-week period after your injection. After using the toilet, flush it twice and then wash your hands thoroughly with soap and water. If you need to clean up any blood, urine, or stool, use medical gowns and gloves. If any blood, urine, or stool gets on your clothing, wash the clothing right away and separately from your other clothing. If you experience nausea, diarrhea, or vomiting that persists or worsens, it is important to contact your doctor or pharmacist. Dehydration is a potential risk, especially if vomiting or diarrhea continues and you are unable to drink normally. Contact your doctor immediately if you notice symptoms of dehydration, such as an unusually dry mouth, increased thirst, fast heartbeat, or dizziness/lightheadedness. Despite the potential for serious side effects, your doctor has prescribed this medication because the benefits outweigh the risks. Careful monitoring by your doctor can help reduce the risk. Contact your doctor immediately if you experience serious side effects, such as easy bruising/bleeding or signs of kidney damage, like a change in the amount of urine. This medication may increase the risk of bone fractures. Tell your healthcare provider if you experience bone pain or changes in movement. This medication may lower your ability to fight infections, making you more susceptible to serious or worsening infections. Contact your doctor if you experience signs of an infection, such as a persistent sore throat, fever, chills, or cough. While a serious allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This list does not cover all possible side effects, so if you notice any other effects, contact your doctor or pharmacist. In the U.S., call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. Before starting Radium Ra-223 dichloride, let your doctor know if you have any allergies. This medication can increase your risk of infections, so be cautious around people with contagious illnesses. It's important to avoid live vaccines and take precautions to prevent cuts and injuries while using this medication. Radium Ra-223 dichloride may also increase the risk of other types of cancer, so talk to your doctor about the potential risks. This medication is not recommended for use by women, and men using it should use reliable birth control methods and discuss the potential effects on fertility with their doctor. It's important to note that this medication may interact with other drugs, potentially altering their effectiveness or increasing the risk of serious side effects. Always keep a record of all the products you use, including prescription and over-the-counter medications, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial to seek your doctor's approval before starting, stopping, or changing the dosage of any medication. One specific product that may interact with this drug is abiraterone. Be sure to discuss any potential interactions with your healthcare provider. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. This medication should only be used under the guidance of a healthcare professional and should not be taken without proper supervision. It is important to have regular lab and medical tests, including complete blood counts and kidney function tests, while using Radium Ra-223 dichlor 1100 kbq/ml, 30 microcurie/ml, Intravenous Soln. Make sure to keep all your medical and lab appointments. Be sure to take each dose of this medication as directed. If you happen to miss a dose, consult your doctor or pharmacist immediately for guidance on a new dosing schedule. This medication is typically administered at a hospital or clinic and is not meant to be stored at home. It is used to treat a certain type of prostate cancer that has spread to the bones. The dosage and timing of the medication will be determined by a healthcare professional based on the individual's specific condition. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.